Hello everyone, my name is Dr. Krup Korodia and today we will see the examination of motor function. So when we have to do the motor system examination, first of all we'll do this in partial or total inactivity of muscle, then painful movements, then reduction in size of muscle, then involuntary abnormal movements, and during the difficulty in walking, standing and working. Now, what are the steps of motor system examination? So, the first step is to check the power of muscle. Then, the second step is to check the tone of muscle. Then, the third step is to check the nutrition of muscle. And then, the fourth step is to check the coordination. First of all, we will see how to check the power of muscle. So, power of muscle is tested by examining the ability of the subject to make movements against resistance, which is offered by examiner. There are 5 grading system of checking the power. First grade, no contraction. Second grade, flicker or trace of contraction. Third grade, active moment with gravity eliminated. Fourth grade, active moment against gravity and moderate resistance. Fifth grade, active movement against gravity and full resistance. First of all, in upper limb, we will check the power at finger joints. So first, flexor, ability to flex fingers against resistance. Then second, adductors, hold paper tightly when it's being pulled away. Third is abductors, ability to open fingers against resistance. Then fourth is flexors and extensors of metaphalangeal joints, ability to flex metacarpophalangeal joints and extend interphalangeal space against resistance. And fifth one is movement of thumb, ability to do extension, flexion and opposition of thumb. Now we will check the power at wrist joint. So first one is flexor, bring the finger towards forearm. Second is extensor, make a fist and try to extend wrist against resistance. Now we will check the power at elbow joint. So first one is flexors. Flex the forearm elbow joint against resistance. Second one is extensor. With forearm flexed, ability to extend elbow joint against resistance. We will check the power at shoulder joint. So first one is abductors. Ability to abduct arm against resistance. Second one is adductor. Ability to adduct arm against resistance from the position of abduction. Third one is external rotator. With arm adducted and flexed at elbow, ability to rotate it laterally against resistance. Fourth one is internal rotator. With the arm adducted and externally rotated and flexed at elbow, ability to rotate it medially against resistance. Now, fifth one is pectoralis. So, ask the subject to stretch his arm forward and to clasp his end. Then feel the contraction of pectoralis. Sixth one is latissimus dorsi. Ask the subject to cough and feel the posterior axillary for contraction. Seventh one is serratus anterior. Ask the person to push his outstretched arm against the wall and look for the winging of scapula. Now we will check the power of muscle at scapula. So first one is elevators. In this examination, ask the subject to shrug his shoulder while examiner tries to press them down from behind. Second one is depressor. In this examination, ask the subject to approximate the shoulder blade. Now we will check the power of trunk muscles. So first one is flexors. Ask subject to raise himself in bed with the hand of examiner on his forehead for resistance. Second one is extensor. In prone position, ability to raise his head against resistance. Now we will check the power of neck muscle called sternocleidomastoid. In this examination, turn the neck on the opposite side against resistance. In the lower limb, we will check the power at hip. So first one is flexors. With the knee extended, ask subject to raise his leg off bed against resistance. Then second one is extensor. With knee extended, ask subject to lift his foot off the bed and ask him to bring it back to the bed against resistance. Then third one is abductors. Ask subject to move limb outward against resistance. Then adductors. With the limb abducted, ask him to bring it inward against resistance. And fifth one is rotator. With limb extended on bed, ask subject to rotate outward while resistance is offered by grasping the foot. Now we will check the power at knee joint. So first one is flexors. Ask the subject to flex the knee against resistance. And in the examination of extensor, ask the subject to extend the knee against resistance. We will check the power at ankle joint. So first one is dorsiflexors. Ask the subject to elevate his foot against resistance, and in the plantar flexion we will ask the subject to depress his foot against resistance. Then we will check the power at foot. So first one is eversion. We will ask the subject to turn his foot outward against resistance, and in the inversion we will ask the subject to turn his foot inward against resistance. Now we will check the power at toes. So first one is flexors. So ability to plantar flex the toes against resistance. And extensor, ability to dorsiflex the toes against resistance. Now second one is tone of muscle. So how we will check the tone of muscle, and what is the tone of muscle? So tone of muscle is the resistance offered by muscle while performing passive movements. Hold the limb and carry out passive movements at various joints and note the resistance offered by that particular muscle or group of muscle. When there is increase in tone of muscle, it is called hypertonia. And when there is decrease in tone of muscle, it is called hypotonia. In hypotonia, no resistance will be felt and muscle will be soft on palpation. In hypertonia, there is four types. First one is clasp knife, second one is lead pipe, third one is cogwheel, and fourth one is hysterical. So in clasp knife, increased resistance felt initially only during movement. Now in lead pipe, increased resistance felt all through the movement. Third one is cogwheel, interrupted resistance by muscle. And fourth one is hysterical, resistance increase as the effort to perform passive movement increased. Now third one is nutrition of muscle. So how we will check the nutrition of muscle? With measuring tape, measure circumference of extremities where maximum muscle tissue is present. Note the bulk of muscle and palpate it. Wasted muscle looks thinner and feel soft when contracted. Compare the size and shape of identical muscle on both sides. Now fourth one is coordination. So coordination is the coordinative action of separate muscles or a group of muscle in order to accomplish a definite act. If such coordination is absent or imperfect, the performance become erratic, difficult or impossible, which is called ataxia. Now in upper limb we will do finger nose test. So in this test we will ask the subject to touch the nose with the help of index finger and repeat this movement. Now second is finger test. In this test we will ask the subject to place arm wide apart and touch index fingers of both hand by moving his both arm closer. Now third one is pronation supination test. In this test we will ask subject to do rapid supination and pronation of both hands. Now fourth one is finger thumb test. In this test we will ask subject to touch the tip of fingers with the help of thumb. Then lower limb. In lower limb we will do knee heel test. In this test we will ask subject to touch knee of one leg with the heel of opposite leg and slide till the ankle joint. Second test is making circle in air. In this test we will ask the subject to make circle in air. Now third test is rhombus sign. In this test we will ask the subject to stand steady with feet together and eyes closed. Fourth test is walking on a straight line. In this test we will ask the subject to walk on a straight line with one foot toe which touching the heel of another foot. Now we will check the abnormal movements. So first one is tremors. It is regular or irregular distal movement having oscillatory character. Second one is tics. It is simple normal movement but repeated unnecessarily by habit. Third one is choric movements. It is variable, arrhythmic, continuous, dancing like movement. Fourth one is athetosis. It is breathing movement, more in distal and less in proximal muscle. Fifth one is fasciculations. It is spontaneous movements of group of muscle fibers due to discharge from motor units, producing snake-like movements in muscle. Sixth one is myoclonus. It is faster than choric movements of arrhythmic character. Seventh one is torsion spasm. It is like athetosis, but here axial muscles are involved. Tone increases, causing twisted movements of trunk and upper limbs. And last one is hemibellismus. It is rapid, hyperkinetic, flinging motion of arm with great force. Now we will see what are the differences between the pyramidal and extrapyramidal tract lesion. So first of all, in pyramidal tract lesion, spasticity will be seen. In extrapyramidal tract lesion, rigidity will be seen. Now hypotonia will be seen in flexors of arm and extensor of leg in pyramidal tract lesion. But hypotonia will be generalized in extrapyramidal tract lesion. Now tendon reflex will be exaggerated in pyramidal tract lesion and tendon reflex will be normal in extrapyramidal tract lesion. Now Babinski sign will be positive in pyramidal tract lesion and Babinski sign will be negative in extrapyramidal tract lesion. Involuntary movements will be absent in pyramidal tract lesion and involuntary movements will be present in extrapyramidal tract lesion. Now we will see the differences between the upper and lower motor neuron lesion. So first of all we will see the upper motor neuron lesion. In upper motor neuron lesion, spastic paralysis will occur. Superficial reflex will be lost and deep reflex will be exaggerated. Babinski sign will be positive. Muscle tone will be increased. Slight atrophy will be seen. EMG will normal and now conduction velocity is normal. Now we will see the lesion of lower motor neuron. Flaccid paralysis will occur in lower motor neuron lesion. Superficial and deep both reflexes will be lost. Babinski sign will be negative. Muscle tone will be decreased. Slight atrophy will be seen. EMG shows the changes of denervation and now conduction will be decreased in lower motor neuron lesion. What is hemiplegia? Hemiplegia means the paralysis of one side of body and it occurs due to the injury at internal capsule level. Now what is paraplegia? Paraplegia means the paralysis of both lower limbs. It occurs due to injury at brainstem level or in spinal cord below mid-thoracic level. Now what is hemiplegia? Hemiplegia means the paralysis of all four limbs. It occurs due to injury in spinal cord above upper thoracic level with the involvement of cranial nerves. Thank you very much for watching this video.